Your heart is racing. So is it AFib or something else? Most people don't realize that they're not the same, and confusing them could mean the difference between a stroke or just dehydration. Here's how to tell. If you care about your heart, hit subscribe. This is what doctors don't always have time to explain. Let me tell you about a patient I'll call Adam. He was 68 years old, retired, reasonably healthy. One evening, his heart starts pounding, fast, uncomfortable, a little scary. He checks his pulse. It is fast. He assumes it's stress. He goes to bed. What Adam did not know was that his heart was not just fast, it was completely chaotic. That is AFib. And in AFib, blood can pool inside the upper chambers of the heart and form clots. Clots that can travel directly to the brain. Here is what's actually happening inside of your heart. Your heart has an electrical system. In a normal heartbeat, one signal fires from the top, like a conductor raising a baton, and the whole heart responds in perfect sequence. One beat, perfectly timed. In a fast but normal rhythm, called sinus tachycardia, that conductor is just waving the baton faster. Stress, fever, dehydration, exercise, but the orchestra always stays in sync, fast but organized. In AFib, every musician suddenly starts playing their own song at the same time. Hundreds of chaotic signals fire across the upper chambers every minute. No coordination, no pattern, no leader. The result? No two heartbeats are the same distance apart, ever. That irregular pattern is a defining signature of AFib. As described in the New England Journal of Medicine, QRS complexes occurring at irregular intervals with no discrete P waves, no pattern, no two beats the same, ever. And here's what most people do not know. You don't need an ECG machine to suspect AFib. You can feel it. A 2024 review in the American Family Physician confirmed that checking your own pulse at the wrist and identifying that irregular pattern carries 92% sensitivity and 82% specificity for AFib. Your own two fingers, 92% accuracy. Not a replacement for your doctor, but a powerful early warning system. Here are the four most common fast heart rhythms and exactly how each one feels. Number 1, atrial fibrillation. Complete chaos at your wrist. No pattern, some beats close together, some far apart. Patients describe it as a bag of worms or popcorn popping under their skin. No consistent spacing whatsoever. That is your AFib red flag. Number 2, sinus tachycardia. This is the most common fast heart rate. It is usually not dangerous by itself. Fast, but perfectly steady. Even spacing between every beat. Comes on gradually with exercise, anxiety, fears, stress, or dehydration. And slows gradually when the trigger goes away. Fast, regular, gradual. Find the cause, treat the cause. Number 3, SVT. Supraventricular tachycardia. This has a very distinctive calling card, a sudden flip of a switch. Your heart jumps from normal to 150, 180, even 200 beats per minute, instantly, no warning, regular and rapid, like a machine gun. Often ends just as suddenly as it started, sudden on, sudden off, dramatic, but often not life-threatening. Number 4, atrial flutter. Think of atrial flutter as AFib's little brother, more organized, but a little sibling. Fast, but more regular than AFib, often locked in around 150 beats per minute. Regular pounding, requires an ECG to distinguish it from AFib. One critical point. When AFib is very rapid, above 150 beats per minute, the irregularity becomes much harder to detect because everything's happening so much faster. It can actually mimic an SVT and often be misdiagnosed. This is exactly why an ECG is always required for a definitive diagnosis. Always, no substitute. Many of you are already using a smartwatch or handheld ECG device. Can you trust it? Yes, but with one important caveat. A 2024 review in the American Family Physician found impressive accuracy across wearable device types. Smartwatches came in at 94% sensitivity and 93% specificity. Smartphones at 94% sensitivity and 96% specificity. Wearables are a real and valuable tool for catching AFib between doctor visits. A non-12-lead ECG device showed 91% sensitivity and 95% specificity. Those numbers are genuinely impressive. Wearables are a real and valuable tool, especially for catching AFib between doctor visits. But movement and artifact can mimic AFib on a single lead recording. The 2026 Lancet AFib review is clear. Wearable detections must always be confirmed with a proper ECG device before any treatment decisions are made. Here's why getting the diagnosis right matters so much. The treatment for each rhythm is completely different. AFib requires stroke risk assessment, possible blood thinners, and rate or rhythm control. Sinus tachycardia means finding and treating the underlying cause. SVT responds to vagal maneuvers, adenosine, or catheter ablation, often curative. And atrial flutter responds best to ablation medications, frequently fail alone. So treating AFib like sinus tachycardia means missing blood thinners and risking stroke. Treating sinus tachycardia like AFib means unnecessary blood thinners and risking bleeding. The diagnosis drives the treatment drives the outcomes. Here's your action plan. 5 steps that can dramatically change outcomes. Check your pulse correctly. 2 fingers on the inside of your wrist. Count beats for a full 60 seconds. Completely chaotic with no pattern? That is your AFib red flag. Call your doctor today. Know your rhythm by feel. Chaotic equals AFib. Fast and steady with gradual onset equals sinus tachycardia. Sudden flip of a switch equals SVT. Fast and regular pounding equals flutter. Use your wearable device, but verify. Screenshot the alert, note your symptoms, and bring it to your doctor for a proper 12-lead ECG. Never self-diagnose or much less self-treat. Even 90% certainty leaves a 10% gap. That 10% is where strokes and misdiagnosis live. Ask your doctor this one question. Can you show me my ECG and tell me whether my rhythm is regular or irregular? That single question keeps you measurably safer. You now have a framework most people never receive and much less ever hear. You know the difference between a chaotic rhythm and a fast one. You know what to feel for. You know when to act. Share this with someone worried about their heart. Drop a comment below. How old are you? And what does your fast heart rate feel like? I read every single comment. Visit afib.com to download your free AFib patient guide and sign up for our newsletter. I am Dr. Yasser Rodriguez. Take care of your heart because it's taking care of you.